Okay, back again with a new video regarding psychiatry. There are some fundamental knowledges regarding psychiatry. We need to remember those things, but for a time being, I would like to discuss on this. Okay, now before jumping into the psychiatry, I would like to discuss about some topics. There are some psychotic disorder, some neurotic disorder. In psychotic disorder, in here, like some psychotic disorder, there may be brief psychotic disorder. There may be schizophrenia form. There may be schizophrenia and schizoaffective disorder and the delusional disorder. Brief psychotic disorder, full return to function. More than 1 day, less than 1 month, more than 1 day, less than 1 month, one or more than 1 day, less than 1 month. And schizophrenia from 1 or more than 1 month and less than 6 months, and schizophrenia is more than 6 months. So brief psychotic disorder, full return to function. Schizophrenia from functional decline not required, functional decline not required. And schizophrenia is more than 6 months, includes 1 or more than 1 months of active symptoms, includes 1 or more than 1 months of active symptoms, and can include prodrome of our residual periods require functional decline. Schizoaffective disorder and delusional disorder. Delusional disorder is more than one delusion for more than 1 month. High dose glucocorticoid may cause glucocorticoid induced psychosis. This is a very high yield topic. I got a question regarding glucocorticoid induced psychosis. This is the corticoid steroid induced psychosis, typically occur in the first week of glucocorticoid treatment, but can occur at any time. Glucocorticoid can cause mania or depressive symptoms. In general, ways to rule out the medication and the substance use related symptoms first. New behavioral changes in the older patient with no psychiatric history prompt consideration of medical and substance or medication related causes. Indications for involuntary psychiatric hospitalization, including involuntary indication of involuntary psychiatric hospitalization, including begin a danger to self or others, or a grave disability due to mental illness. Hospitalization may be hospitalization maybe implemented hospitalization, maybe implemented in involuntary basis if necessary. Okay, this in these patient, 1 month old after undergoing liver transplantation, she is on IV methylprednisolone. Look at the IV methylprednisolone, which is a corticosteroid, and then she begins to have visual hallucination. Then her organ donor, then her organ donor enter to the hospital, and visual that her organ donor, she begins to have visual hallucination that have her organ donor have entered her hospital room naked and is drawing symbols on her skin with her eyebrow pencil. So she is on psychosis, some sort of psychotic behavior. She says that she's worried about her visual hallucination and she's worried, she's oriented. This one is very high oriented to time, place, person. It can be delirium. You have to differentiate in between these two, like delirium and the corticosteroid induced psychosis. In patient with delirium, cat level will be lost, consciousness, attention, thinking. There may be hallucination, but orientation to time, place, person will be impaired, will be hampered. So this is one of the most important, that high dose glucocorticoid may cause glucocorticoid induced psychosis. Okay, so you have to differentiate between the two schizoaffective and the delusional disorder. Delusional disorder is one or more than one delusion, and 1 or more than 1 month, no other psychotic symptoms. Normal functioning, normal functioning apart from direct impact of a delusion, normal functioning apart from direct impact of delusions. And the schizoaffective disorder is mood episodes with concurrent active phase of symptoms of schizophrenia with 2 or more than 2 weeks of delusion or hallucination. About 42-year-old woman 42-year-old woman gravida 1 para 1 comes to the physician because of 5-month history of increasingly 5-month history of increasingly severe episodes of lower abdominal pain. The pain is exacerbated during bowel movement, sexual intercourse, menses. Treatment with several analgesics has not controlled the pain. Laparoscopy 4 years ago, and the second laparoscopy 2 years ago. For evaluation of the pain associated with no abnormalities. She is sexually active with one male partner. They use condoms for contraception. She is a single parent. Lost her job 6 months ago. She now has difficulty sleeping 1 to 3 nights, 1 to 3 nights each week because she worries about finding a job. Abdominal examination shows tenderness in both lower quadrant. Pelvic examination shows a mobile non-tender uterus. Pelvic examination shows a mobile non-tender uterus. A complete blood count, ESR, PAP, urine, cervical culture shows no abnormalities. Which of the following is the next step to determine the cause of the patient's pain? Mm, Gravity 1, Vera 1, 5-month increasing. She's a single parent, lost her job 6 months ago. She now has difficulty sleeping 1 to 3 nights each week. Hmm.